They're registered nurses and they're entrepreneurs. Today, a growing number of RNs are finding business opportunity in Ontario's expanding healthcare marketplace.
My name is Susan Hagar, and I started a business called Nurse on Board. So we're private patient advocates and healthcare navigators. We're mostly involved with people with complex chronic conditions, in some cases acute situations, people with injuries, disabilities, whatever the case may be. The system itself is very complex, and people struggle to manage their healthcare circumstances, going to medical appointments. Essentially, we can be translators because they don't understand the medical jargon.
My name is Ann Dobbins, and I'm a registered nurse, and I've been a nurse for over 25 years, and I founded a service called Memory Matters. Well, a lot of people are given a diagnosis and given a prescription and left to leave the office and I think wonder, now what? Everybody's different. Every situation is different. Everyone's prognosis will vary, and it's really important that someone be involved with the family to provide ongoing education and support.
My name is Gigi Vandenhoof. I started my own business as a medical science liaison and a clinical research nurse, and I currently have a contract with working with people with Parkinson's disease. People are leaving the hospital sooner, so they are sicker when they're leaving. So we are there to advocate for the patients to make sure that they get what they need.
Vandenhoof, Dobbins and Hagar are all members of the group Independent Practice Nurses of Ottawa.
We get together once a month to provide support to each other and to find out what we were all doing. We seem to fill a gap for the need that's here in Ottawa with each of our unique businesses.
My name is Marian Mead. My business name is called Marriage Minded. I've been a registered nurse for over 35 years. We've been living with the medical model where we find a problem, then we try to fix it. The way that we deal with it is we want to find solutions. We want to help people remain healthy. And if there are problems, we want to help them to have the maximum amount of health that's possible for them and to live their life fully and well in spite of whatever it is that they're going through.
My name is Kyla Killane, and I own a company called Next Step Transitions, and we are a nurse-managed construction company that specializes in home accessibility. It's been wonderful to connect with a group of nurses. We're bound by codes of ethics and best practices.
Colleen admits one of the biggest challenges is getting the word out about what nurses in independent practice are doing.
There's almost a disconnect in the medical community and nursing community itself that are not aware of all the additional, very innovative services that we provide in the community. And we're really filling in some major gaps that exist that's not supported by the publicly funded system. And if there wasn't a need for that, none of us would be in business. None of us would be continuing to do what we do. So until the health system can support that and really start moving towards dehospitalization, which we need to do, and which is, I think, the focus, then we can really start connecting and really utilizing the skills that independent practice nurses have.
My name is Catherine Harley. I've been a registered nurse for over 30 years. In 2002, I started a company called Global Healthcare Projects, Inc. If we are going to make changes in the healthcare system, we do have to be able to innovate, and we have to lead through change.
Harley says it's the reason education and mentorship will always be priorities for the Independent Practice Nurses of Ottawa group.
We always say that you have to be able to lead where you land, whether a nurse is at the bedside or whether they're the CEO of a company. But there are additional skills that you need to know about, you need to learn, you need to take courses. I do think that leadership in nursing needs to be built. I think that we need to expose registered nurses to leadership programs, mentorship programs, and help them find the leader within.
This is Greg Van Asperen reporting in Ottawa.